so they can see me. So I'd first walk into the door, or I'd check the order, see that they have a baseline assessment ordered. Knock, knock. Hi, Mrs. Bailey. My name is Garrett. I'm going to be your nurse today, and we just got a few things scheduled today. We're going to do a baseline assessment. We're going to do a Foley catheter, and we're going to give you your meds. Baseline assessment, just make sure you're doing okay. We're just going to assess and see if anything's changed, just stuff like that. The oral meds will help you feel a little bit better. That Tylenol for your pain, and the potassium as well to elevate your potassium levels, prevent hypocalcemia, and then the catheter because you're retaining some urine, so we want to get that all drained out. I would close the doors around me. I did my hand hygiene. Can I verify your name and date of birth? All right. I would check this, see that lines up, and it does. I would assess for any tubes, anything I might trip on, just a general survey of the room. How are you feeling today? I'm assessing for mood, stuff like that. And make a little small talk to kind of assess for that mood, see if they're acting abnormal or if everything seems okay with them. Do you know where you're at right now? Okay, do you know what the date is? And can you tell me who the president is? And the patient is 42 times 3. Let me go grab that paper. I would get my vital signs, and the blood pressure is 128/72, which is normal. Pulse is 78, which is good. Respiration is 18. O2 99% room air, which is fine. Perfect. Well, super good. Temperature is 36.9 degrees Celsius, and that's good. Are you allergic to any medications, and are you taking any medications? Ask for allergies and what meds they're taking. Have you had any surgeries recently? Okay. And I can get just medical history, stuff like that. I'm gonna go ahead and look at your eyes now. I see that the pupils are round, equal, reactive, and accommodative to light, the perla. Are you in any pain right now? And it says here that I'm pain 7 out of 10. I would now do Caldera, which is to assess her pain, which is C for characteristics, O for onset, L for location, D for duration, E for exacerbation, R for radiation, the other R for relief, and A for associated symptoms. After that, I'm just going to go ahead and feel your face right here, feeling the lymph nodes, feeling for any deformities. I will then grab my pen light, go ahead and look at your nose, looking for any fluid, any weird looking fluid. Same in her ears. Any fluid, any sign of infection. Those look good. Now I will go ahead and ask about the chest. Have you had any chest pain recently? Not really, okay. It's okay if I go ahead and take a look at it. I inspect for any cuts, any broken skin. Just make sure it all looks okay. Oh, I would also, on the face, I would look for any face droop, an uneven smile, just any possible stroke symptoms or any neurological deficits. But back to the chest, that all looks okay. Yep, looks good. I'm gonna go ahead and listen to your heart now. I listened to 5 points. First, the aortic, then the pulmonic, Erb's point, the tricuspid, and then the mitral. And I listened to the mitral for a whole minute. After that minute's passed, Everything sounds good. Heart has S1 and S2 sounds. Cover that back up. Have you had any difficulty breathing? Any pain there? Alrighty. Have you had a cough recently? Okay. No cough, no pain while breathing. I'm gonna go ahead and listen to 6 spots on the anterior and posterior sides of the patient. This one, 1, 2, and I have to take a deep breath in and deep breath out at each point. Again, again, and again, and again. That'll help us sit up a little bit. 1, 2, 3, 4, 5, 6. This bed's a little bit low, so I'm going to raise it up a little bit. I would have done this beforehand. Oops. I would check, make sure this is not going to fall. Okay. I would then, after the lungs sound good, there's no cough, no pain, I would ask about the bowels. Ask about any pain. I'd first go ahead and inspect and try and check the patient's privacy a little bit. First inspect. It looks normal. There's no bloating, no distension. I'd ask about the pain, and obviously there's pain because she has colon cancer. She just had something done to it. I'll go ahead and auscultate to all 4 sides. I'll probably be a little bit careful right here where it's painful. Alrighty. I'll go ahead and palpate each side and ask about pain. Does that hurt? Up there, there, and there. And obviously there's a little bit of pain there just because of the situation. I will then, I'll pull this down a little bit. Then go for the musculoskeletal system, or and I will, well, I'll just go for the skin in general. I'll go ahead and assess her arms, looking for edema, and checking the temperature, color. I see that she has an IV in. And no edema, no, it's not too hot or too cold. I would check for turgor. Like I said, the color is also fine. There's no visible wounds, anything like that. We'll go ahead and listen to pulses on all 4 sides. Hope that can see me. I'll go ahead and listen to these at the same exact time to make sure that it's in sync. Okay. Can you push my hands down with your feet and push up? And go ahead and squeeze my hands. All right. I would have them walk to the door and back, and I would assess gait, make sure they're walking okay, they're not kind of walking funny. I would ask about their bowel habits. Have you been going to the bathroom? Been having bowel movements regularly? I'd ask about their diet, see what they're eating, stuff like that. Any pain with it? And what about urine? Are you urinating okay? Any pain? I'd ask about frequency, stuff like that. I see that they have an IV. I would make sure it's secured and it doesn't need to be changed, along with any other tubes or anything that they might have. She's on oxygen, so I don't need to assess that. I would go ahead and document my findings, and I would move on to my next step, which would be the oral medications. I'll tell them I'm gonna go grab your medication real quick. I'll be right back. I would remove these gloves. Before I left, I'd remove these gloves, and I would perform my hand hygiene. Then show it over here. She didn't give me any med cups. So I don't have any med cups, so I would go and find them. But for the sake of the video, we'll just pretend. I'd grab my two medication. Well, I'd grab my first medication. I see that she's scheduled for potassium. I would do my first check. See that I've got potassium right here. Well, let me go get all my stuff set up first. So just go ahead and bring my med over here. I know what I can use. We'll say this is my med cup because I don't have another one. I see, so I grab my med, I did my first check there. I would do my second check right here. I see that it's 10 MEQs and this is, it's scheduled for 10, this is 20. So I would need to do half of this. I got half and I do a cup. That'd be my second check right there. I'd go through my 6 patient rights, make sure I have the right patient, the right drug, the right route, the right dose, the right time, and the right reason. And that all looks good. Go ahead and bring this out into the patient's room. Knock, knock. Whoa, what am I doing? I would have gloves on for this entire procedure. I would perform my hand hygiene and put gloves on. I'll go do that right now, but I'd have gloves on while I'm preparing the meds. Knock, knock. All right, we're going to do your oral meds now. I close the door behind me, make sure that their privacy is respected. Hand hygiene. And I've already talked to them about their allergies. I can see that they're allergic to Percocet. Gloves on. This potassium is going to help with your potassium level just to prevent hypocalcemia. I just do my patient teaching. I see that 10 MEQs is a regular dose, so it's not going to be toxic. I just do my patient education. Go ahead and ask for the name and date of birth again, clarify that. Doesn't really want to scan. There we go. Get that scanned. Scan the medication barcode just to ensure we have the right medication, and we do. So they have their water. I would do my final check right here. just to confirm I have everything and I've got the right med. I know it's the right route, right dose, right time. Confirm the dosage one more time, and that looks good. Alrighty. Go ahead and have the patient up sitting up. The rest of the med. Water. Ensure that that's gone down all right. I'll go get the Tylenol now. Gloves. Don't want to leave meds in the patient's room, so we'll go ahead and move these out. Go grab the Tylenol right here. I do my first check right as I'm grabbing the Tylenol. Make sure I have the right med. So I do my first check right there. I'm doing my second check right here. I see that they have 650 milligrams ordered, which is a super good amount. It's not going to be toxic. Geez, I did it again. I have gloves on right here. What am I thinking? Hand hygiene. Always have gloves on with hard meds. That one. Usually it's 325, so I do 2 of them. Go. I go through my 6 patient nights with this one as well. I don't think that's not just like, that's a good angle. Put this back over here. But I go through my 6 patient rides again, make sure that it's right patient, right dose, right route, right time, right reason, and right medication. Go ahead and bring these over. Knock, knock. All right, this is your acetaminophen. This is going to help with your pain. You see there's a 7 out of 10. We want to hopefully get that lower down a little bit, get you feeling better. Check their wristband again, check their date of birth and their name. Then I would ask if they have any questions about the medicine, and answer any medications, calm any fears, any worries. Go ahead and administer those. Excellent. Move these gloves for hand hygiene. And then I'd go ahead and follow up them with the medications. That's about their effectiveness in about 30 minutes. But I'll be back in here in a second anyway, so do your catheter. This over here. This over here, actually. All right, I would then grab all of my supplies for the catheter. So I grab this. Sterile gloves. All right, so I knock, knock. Mrs. Bailey, I'm back. We're just going to go ahead and insert that catheter for you. The catheter is just because you're retaining some urine, and we want to make sure that we get that all drained out. I'd explain the procedure. There is some mild discomfort with the catheter insertion. Hopefully that Tylenol is going to be kicking in soon, and it'll help with that discomfort. I would calm any anxieties or worries that the patient might have. I'd explain the procedure, check for any cords I might trip on, just general safety of the room. I'd go ahead and close the doors and curtains around me if there were any. I would then I checked the order, made sure that we had the catheter ordered. I would check their name, date of birth, stuff like that. I would then, oh, I need my wipes. I'd have those before I entered the room. Okay, try and cover them up a little bit. Just expose the stuff we need. All right, Mrs. Bailey, I'm just going to go ahead and clean the stuff that will be inserted, but the second will be inserting the catheter just to prevent any infection. Let's get these legs. The stethoscope. All right. I would first clean. We don't have a urethra. I don't know what to do. Should I pause the video? I would first clean down, and then down the middle. Okay, I'm gonna pause the video and go get Steph and see if we can get this fixed. I don't know what else to do. Here and okay, my patient now has a urethra, so now we can continue. So let me get my gloves back on. Hand hygiene. I went ahead and cleaned it top to bottom, using a different part of the wipe each time. Did I do that? I don't remember how I did that. So now I'm insecure and I need to redo it so I feel better about it. So I'd go one wipe, go ahead and fold it. One wipe, go ahead and fold it. And one wipe down the middle, just making sure you're using a different part of the wipe every single time. All right, then I would go ahead and move these, get them out of the way. I'll bring this tripod over here so we can see me do the, get my sterile gloves on. I'll put it right here. I'd remove these, or first I'm gonna open my packaging. I need to do that first before I become sterile. Put this right here, this way, that way. Right there. You can see me. Okay. Open away from me. Making sure we're only touching the outside inch of this lining. Remove those gloves, on hand hygiene. Now we'll become sterile. there. I really hope they can see me. I think I broke sterile field. I think I touched my hand right there. I'm gonna go ahead and scrap this and get a new pair. So I got my new pair. It's good to change your stud gloves, even if you're just a little bit unsure, like maybe I did, maybe I didn't. Good to change your gloves. Better safe than sorry. All right. Ooh. Go ahead and adjust these as needed. Got our hands in. I did not think of this. I have to not. I will ever so carefully move. Oh, I should have it over there. I don't know how to move this without breaking sterile field. I don't know if it's okay for me to just move it. But I don't want to test that, so I'm just going to kind of slide it all the way over here. This is a lot easier than just on recording for you. I just realized. All right. Excellent. Okay. Back to work. We don't need these. This is sterile. Oh, I would also have them in a dorsal recumbent position. I would have somebody come and, since I'm already sterile, I'd have someone come and help me with it. Just like that. Okay. Sorry, I'm all over the place after that little mishap. Go ahead and let this fall open. I hope I can see. Ease that in right there under her. Grab my other one. Expose the area we'll be working on. I don't know if I can see. I'm going to adjust this a little bit. Okay. And just kind of get everything laid out nicely where I need it. want to make sure that the patient's not allergic to any iodine if this was iodine. Get my lubricant. And you want to lubricate this pretty generously. Get our saline. Get that all connected. We'll then grab this, place it right here. Making sure we stay sterile when we do it. Go ahead and move this from there, move that away. I'll now break my still field on this one hand so I can clean. Go ahead, one side. The other side. And down the middle. Make sure we keep this hand sterile the entire time. Now that we're clean, we're ready to insert. Go ahead and grab this. Feed it into there. Feed it 2 to 3 to 4 inches until we see some urine coming out of it. We'll know we're in. We'll grab this and inflate the balloon inside. All right, that's in. We will then, we just make sure it's in there. We'll go ahead and change our gloves. We'd get a urine sample right now if we needed one. We'd collect it in this right here. So if we need a urine sample, we'd grab it then. Take these gloves off. Go ahead and perform our hand hygiene and get some new clean gloves on. And I think I have. All right, get this glove on. And I drop it on the floor. Open it first. All right. Go ahead and take this out. Move this. Bring the bag over the leg. This is different than what we used earlier. We're not supposed to stick these on right now. Put it right here. And we would clip it on to the outside of the leg. And glad over that. Just to make sure it stays secured, I would label, initial, and slap it on there as well. We'll hang this on the side rail. Well, not on the side rail, but like onto the bed. Make sure it doesn't get yanked out or anything like that. We'll keep that right there, kind of stuck. We'll go ahead and assist our patient back to a comfortable position. Open up all of our stuff. Remove our gloves and do hand hygiene. Assist their bed back down. And then, like I said, we'd go and chart the baseline assessment, the oral meds, and this catheter insertion. We would make sure the site's intact, the patient's comfortable, stuff like that. Yeah, document hand hygiene, and make sure the patient doesn't have any needs. We'd come and reassess them as needed, and we call it good.